Welcome to another episode of the Granite List Live, where we discuss all things related to employee benefits and human capital. I'm Lee Dill.
And I'm Sally Pace, and we are so excited about today's show. We are joined by Superfeet's Colin Andrews and Gilmore of Work Right. Gentlemen, before we dive into the topic that we're going to explore, do you two mind giving just a high-level overview of each of your organizations?
Hi, I'm Colin. I'm with Superfeet, and Superfeet, we're a manufacturer of insoles. We've been doing that for about 47 years. We were started with a company called Northwest Podiatric Labs making custom orthotics for doctors. And our purpose is we want to make a positive difference in all the lives we touch. So we took that from a custom orthotic lab and moved it into affordable underfoot support. We primarily have been working in the recreation and hobby space. We also have a medical component, being that we were launched from a podiatry lab. But that leads us to here, where people in the workforce find us either through their hobbies or through their healthcare providers. But we've been seeing an influx of just workers asking about our products, and where we led to be here today and talking about Work Right, which has been an instrumental piece of getting us to this point. And we're really excited to launch our business unit around work.
Fantastic. Yeah. At Work Right here, we are an injury prevention group. We specialize in the industrial space. We are geared around early symptom intervention, based right in facilities, whether that's distribution, manufacturing, warehouse, construction, working with the boots on the ground, the team members that are doing the day-to-day work. We're focused around ergonomics and musculoskeletal needs, really working to get the care to people that need it, hopefully keeping them nice and healthy and going home feeling just as good or better than they showed up for work. And so that's our focus.
Well, tell us how Superfeet and Work Right became a partnership. Got a good story for us there?
Yeah, it's actually fantastic. So one of the things that we really focus on here at Work Right is not only just serving our clients within the scope of work that we offer, through early symptom intervention, through ergonomics on-site, coaching, wellness, but truly to be a partner with them and find ways that we can help solve problems they're having outside of what maybe is our defined scope of work. And so one of our partnerships, Rivian Automotive, we've got a team there that is working with their EHS, their safety and their HR teams. So we're always just collaborating with them on what's going on and where their needs might be and how we can help them out. And through some discussions that were taking place on site, one of our clinicians, his name is Aaron, he's our manager there. I heard them talking about insoles and how they were going to approach this and could this bring about some positive for their teams. And he just happened to chime in and say, as clinicians, we focus kinetic chain, ground up. So our clinicians are always looking at what kind of footwear, what's underneath the foot of the worker, the industrial athlete, and how can we help? He goes, I have a recommendation of somebody we really like. And so he took it upon himself to reach out to Superfeet and let me know. And we kind of got the group together. And we were lucky enough to get connected with Colin at that point, which that's just kind of a happen chance that was fantastic, not knowing really who he was, but he happens to be right there in the local area. And so that was kind of the first introduction to Colin. And then a phone call happened between he and I. And things just escalated quickly when we saw that everything really aligned well between our group. So really it was one clinician looking for a way to solve a problem for a partner of ours that led to a much bigger opportunity.
So what opportunity is that? Can you give kind of some color around where you're solving these problems?
Yeah, one of the things that we really try to do is provide resources and tools for our clinicians to meet the needs of the everyday workforce, the team members that are on the floor day to day doing the jobs. And in most of the facilities we work in, they're on hard flooring, whether that's concrete, whether it's a job site, whatever it may be, but they're on their feet constantly. And these shifts can be everywhere from 8 to 10, 12 plus hours. And unfortunately, oftentimes we notice that the footwear gets pretty worn down. And so a lot of what we focus on is exactly that ground up type of impact on folks. And so our clinicians are constantly looking at shoes and footwear and insoles that are going in to help these folks. And oftentimes it's really hard to tell somebody you need to go buy a new boot. Boots can be really expensive. They can be a pretty big ordeal for somebody. But we know insoles are a way that we can get a more cost-effective and a really effective just solution into the footwear they have. And so the partnership between the two of us really meets the need. Our goal is to create a healthy environment and healthy people. And so the mission's aligned really, really well in regards to our clinicians needing a resource we're not a product company, we're a service company. And Superfeet, who has a product that met that need really, really well, and then just to have the mission and the vision aligned like it does, has made it to be this really unique partnership. And quite frankly, one that we've made very formal in the way that we partner and the way we take it to our clients. It's just now part of our everyday offering from our standpoint. I don't know.
Yeah, from that initial client meeting at Rivian, I went there, I gave our product presentation, talked with the team there, and it was evident that the Rivian team was very interested in the insole program. But really what caught my eye was Aaron's feedback, his questions, and I was not aware of Work Right, but I got engaged with Aaron and I saw, wow, he has a similar mindset that what we have at Superfeet. And Superfeet at that time, we were very, very focused on retail and our retail partners, but we had been getting inquiries after inquiries from companies of employee wellness programs. What do your insoles do for our employees? And so I saw Aaron and I talked with him a little bit more about what they do and how they interact with people and the benefits they provide. And as Ty said, he started talking about from the ground up and the kinetic chain and foundational support. And these are all buzzwords that we use at Superfeet. And so I had the kind of light bulb moment of I need to talk with more people in this company because I think we really could work well together. And so that's when I pressed Aaron, I need to talk to someone. He got me in touch with Ty. I think we've had a couple conversations while we were on vacation back and forth, but we really kind of hit it off. And it's been fantastic ever since then. Really, exactly what Ty had said. Really, what is the best for the end user? We don't want people to go home and what they think about is, oh my gosh, my feet, my lower extremities are just tired and I can't do anything else. That is not a good way to go about. We want people to, when they're at their job, focus on their job. When they're home, go and spend time with your family. We're both aligned on that, and it's exciting to be together and how we can move forward. So it's been great. It was a chance meeting that really has turned into something wonderful.
So it's awesome to hear how missionally aligned you both are. We've known Work Right for a long time here at the Granite List and love the way that they approach the industrial athlete. So Colin, walk us through a little bit. It sounds like, maybe this concept clearly was not what Superfeet started out working to address or that population. Can you talk about the specific needs in the industrial setting that did prompt the development of the Superfeet? Both, I know you have two products, the Work Cushion and the Superfeet Work Cushion Slim insoles. Can you tell us a little bit about that?
Yeah, so just to step back. So we were focused on kind of that medical and recreation and hobby kind of mindset where, again, when people are healthy and happy in that kind of setting, they have pretty good quality of life, right? I mean, if you can do what you love, it's a good thing. But as we got more and more inquiries about the industrial space, then we started thinking, okay, people use our products in that space, but it wasn't something that we necessarily went out and designed it specifically for. So then we started to take a look at, okay, what are the needs of that industrial athlete? And really the industrial athlete is a traditional athlete on steroids because they are on concrete floors. They're pulling, pushing, lifting, plus for 8, 10, 12 hours shifts at a time. So it is very, very demanding. And so when we were looking at it, we thought, okay, our products can work there, but we can make a better product that is better suited for those needs of that industrial athlete. And really, the partnership with Work Right has really helped us, given us insight into what that consumer needs and what those industry workers are really dealing with. They've given us access that we wouldn't have gotten in the past. So it's been that way. The partnership has been fantastic as well. But we've really uncovered a lot of tweaks to our line for those two products specifically. I think it can help the worker out.
An aspect of this partnership that's been really good is that we have a mutual goal, but they're able to, just like we are, pivot and move and adjust as the client or the partner needs. And so when you look at those lines of insoles, again, the old ones worked. The other insoles all worked. Our clinicians were using those. But as we sat down with our partnership, some of the things we had to think about was what was ease of entry and cost effectiveness and low on logistics when it comes to how many varieties they're going to have on site. And so when we started taking feedback from our partners, our clients that we were working with, those were some of the aspects they wanted. It wasn't just as much about the specific product, though it is fantastic and they've continued to gear it towards that type of individual. It also was geared towards what's the mode of entry and ease of use. And Superfeet, as an organization, said, hey, we can make that an easier thing for you as well. We can help eliminate some of those barriers, which helped us from a partner be able to produce that and give that to our clients in a much more simplified manner. And so that's one of the things I've really appreciated is this line that has been really geared towards suited that. The other thing is we heard, well, we can't look at images of people on the slopes or running the track. These are people that are welders and they're pipe fitters and they're on a manufacturing line. None of these pictures look like these people. And so that was another aspect where Colin and his team said, you know what? You're right. Let's figure out a way so it speaks to those individuals. So when we go sit down with them, they're more open to accepting it and wanting to use it because they can relate to it. So they met it both on the product side, but also the person side, which for our clinicians, the behavior side of how we get them to take care of themselves is probably the number one thing. So it was a really cool thing to see them pivot and be able to adapt.
So I bet you never thought that your clinicians were going to be soul salesmen as well. But what is kind of some of the data that you're receiving back that's really adapted your product line, Colin? And can you give us an example of a particular client that you've really seen impact on those workers there with your insoles?
Yeah, so we've been doing some studies and we're continuing to do studies. Some people within Superfeet walls consider us an education and research company more than a product company. And in this environment, we definitely are on that track. We are doing a lot of research around just the benefits. And we have some to share. We did a research with the Work Right team of a manufacturing company, and we provided insoles, and we surveyed them before and after. We surveyed them before, and some of the stats there are 97% of employees experience some type of foot pain. 95% experienced some kind of lower back pain. In the 70s, people were experiencing just overall body discomfort. And then after 30 days of wearing our products, over 80% of the people had a reduction in the foot pain that they reported. 84% of people had reported less back pain, 70% reduction of knee pain. So our purpose is, again, for people when they go to work to be productive and think about their work. And those stats really kind of showed that we're on the right track with that. And so we're continuing to do studies, but it's fantastic to see, and we continue to refine our questions, but it's definitely so far working really well.
And Lee, it's interesting that you asked about what our clinicians see themselves as. One of the things when we sat down with Colin and his team was that our primary goal and our only goal needs to be about the team member themselves, and it's got to be clinical in nature. For them, we made sure there's not any compensation for our clinicians. There's nothing like that would hinder the ability to say that this is a very objective thing that we're going to be providing to you or recommending. And so to be able to do research and look at and study the results that are actually impacting not only the team members for the better, but then the organizations we work with, right? Because it's the ripple outside of just the team member themselves. We want them to feel good and for them to be a healthier version of themselves. But then also, how did that impact the organization? Was there a reduction in injuries? Was there a reduction in fatigue? Was there a reduction in days missed? All those types of ripple effects can come out of this. And so in that study that Colin was mentioning, we had 97 people that tested this out during that time period. And to have the type of results that we saw, not only was it good for the team member, but the client themselves, the executives themselves, HR teams could look at it and be like, man, this had an impact in our organization that made us better in more ways besides just team member health, but overall organizational health. And so the studies that we've been doing like that, and we've got several others as well, continue to help reinforce and back and support that it truly is providing a clinical need for the team members on site.
Okay, so I want to dig into that a little bit because obviously the success that you just described validates the idea of the two of you partnering together. Can you give some specific success stories or a success story?
Yeah. So, we've had lots of them along the way. We've got individuals that will talk about that they've been able to go home feeling better than they were before. So we've got lots of team member specific ones. But when you look at things, I'm going to take maybe Rivian as one example. They've been able to utilize this. And because of seeing the results that have come in, it's even changed some of the process and workflows they've had in their organization in regards to PPE, protective equipment. Things like anti-fatigue mats on the floor versus insoles in the shoe. We know that when we put a fatigue mat in front of a station, It helps the person when they're in that spot, that 2 foot by 3 foot spot. We put an insole in their boot. We know that we're helping them when they walk everywhere around the facility. So when we started seeing some of those successes, that they were starting to adopt that for new team members that come in, it's just an added benefit for those departments. How cool is that, right? Hey, I joined this new company, and oh, by the way, day one, I'm going to give you some insoles because we want you to be comfortable and we care about you. It was such a great win to see that it was helping the organization, but it was also helping the team member. And what a great boost, right? Hey, this company cares about me. It didn't cost me anything. I got this insole that's going to help me feel better each day. So that was a pretty cool success. When we started seeing that it was impacting some of the actual workflows and impacting some of the way they were treating departments and stations from a protective equipment side, it was pretty cool.
So, Colin, from a product development side, what are you thinking from these success stories you'll do next?
Yeah, so one of the things that we continue to work on are these products really working in the marketplace. I mean, we launched them, so we have early feedback, like we've said. And so it's a constant flow of where we can go with the product. We have a great team with Work Right that gives us consistent feedback, which is always appreciated. But we're always looking at developing different products, developing different programs. We have a lot of education materials. I mean, it's education materials and content for not just the Work Right team, but also for the different companies that we work with on the value proposition and what to expect. So forward thinking, it's the products are one thing, but just in terms of the general program around work and how we can focus on it. Because with this business unit and focusing on that industrial athlete, it's not just product specific. It's rounded into how we can better serve the entire company. As Ty said, I mean, we're trying to prove that there's economic benefits, that there is productivity benefits. So really kind of being that true partner with companies is our goal, and we're moving in that way.
You couldn't ask for a better partner in those efforts, in our humble opinion, than Work Right. So just as we round out the show, I know you all have some collective plans to be visible in the employer space in the coming months. Clearly, obviously, people can go to your websites to learn more, but if they wanted to meet you in person, can you tell us about your presence that you're going to have at SHRM, their annual conference in Chicago, and ASSP in Denver?
So we have 3 shows. It is coming up on show season, so it's exciting. Summer and fall is going to be fantastic. So later on this month, the Work Right team and the Superfeet team will be at the SHRM show in Chicago. It's June 23rd through 25th. So we'll be there together, which is going to be fantastic. Work Right and one of their medical partners will be attending the ASSAP show in Denver, August 6th through 9th. Superfeet will have a little presence in and out of that show. And then again, Superfeet and Work Right will partner up at the NSC show, which is in September.
It's in Orlando this year.
Oh yeah, in Orlando, and and we'll be back together there. So we definitely will be out in force, and we look forward to seeing everybody.
Awesome. Well, thank you guys for joining. Colin, we're thrilled to hear the work that your team is doing in support of the work that Work Right has also established in helping the industrial athlete. It's so neat that the two of you have combined forces and are solving for a problem that, like you said, occurs in everyday life. And Work Right, your team observes it happening in everyday work life. So thank you both for being on. And thank you to our listeners for joining us for another episode of The Granite List Live.
Thank you for listening to this episode of The Granite List Live. Access our entire library by visiting your favorite podcast venue or subscribe on our site, thegranitelist.live.